Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Evey Andersen, a board-certified family nurse practitioner, certified sports nutritionist, homeopath, anti-aging expert, and overall functional and integrative medicine powerhouse. Through her clinic, Green Medicine of Wisconsin, which is based out of Oshkosh, Wisconsin, Evey helps patients navigate complex chronic conditions by blending functional medicine, nutrition, circadian biology, and homeopathy. Her clinic has a special interest in Lyme disease, or Lyme complex, as she calls it, and since this is a hot topic during the springtime in Wisconsin, we're excited to fill 2 of our 4 episodes with some incredibly empowering discussions around Lyme symptoms, treatment, and prevention, all through a functional medicine lens. Our final 2 episodes together are filled with topics that Evey has extensive professional and personal experience with, including circadian biology and how different types of light, like sunlight, red or blue light, impacts us and our kids, as well as how homeopathy can be a natural way to support first aid needs and short or long-term disease. In her personal life, Evey enjoys yoga, spending time in the sauna, and enjoying nature with her husband, daughter, and their 2 sweet dogs. We can't wait for you to meet Evey, so let's jump in. Hey everyone, welcome back to the Motherhood Alliance podcast. We are back with our 2nd episode with Evey from Green Medicine of Wisconsin. Welcome back.
Thank you.
We're excited to be here, and I think everybody who did not listen to episode 1, make sure you go back and listen to that, because in that episode we talked about Lyme disease or Lyme complex, and specifically the transmission and symptoms behind it. There was a lot of really kind of mind-blowing statistics and facts in that one that gives you some perspective into this type of disease. And then in this episode, we're going to be continuing that conversation, honing in on treatment as well as prevention. So this is going to be an episode to share with everybody. But again, we would recommend listening to episode 1 first. So somebody gets bit, or they're thinking that they might have Lyme. What is their number 1 step? Is it antibiotics? Is there something different? What is the typical approach?
Well, it depends if you're established with me or not. So if you are not my patient, what we typically suggest is there are some topical things that we have at the office. There's some silver gel, there's biocidin, like a liposomal formulation that you can use topically. And anybody can purchase these from us and just have in their first aid kit at home, just in case. That's certainly an option. The other things that I've been more apt to suggest lately are some homeopathic remedies. So we have our own first aid kits, and we'll talk about that. But there's one I created specifically for ticks. So there's a couple of remedies in there that I would absolutely start pretty quickly. And that may be plenty. If symptoms are to develop, especially who's not a patient of mine, we'd suggest talking with either a pediatrician or primary care. Say you got bit by a tick. What I would suggest, though, is if you are going to do antibiotics, do not just do 1 dose of doxycycline. That trial that they did on that clinical trial was based on 9 patients. And the only criteria for proving that they didn't have Lyme was not developing a bullseye rash, which, if we talked about in the first episode, is the minority of patients actually have that. So I would, at minimum, try 2 to 3 weeks. Always, always, always take a probiotic, high quality one in between. So if they're a twice-a-day dose, take it at noon, just to make sure nothing bad's going to happen if you take them together, but you want to get the full effectiveness of both of those treatments. So that's typically how we approach patients that are calling us and asking, to get in acutely. And unfortunately, we just don't have space in the schedule for that. But my established patients, we are very good, or they're very good. If there's a tick bite, they call me right away. And then either some of them are on herbal treatment or other treatment so to speak, a combination of things, which we'll discuss. And we can talk about if they want to do antibiotics for a period of time. That's absolutely on the table. It's about their comfort. Like, what do they want to do? So we give them kind of a series of options, and, we can watch and wait. If you're already on something, we can add, different treatments, that's what we typically suggest.
Yeah. So you're very, open to whatever the patients
Absolutely.
need.
Yeah. And they can always call, and, if they opt to watch and wait, and a week later, they're like, I just feel not quite myself, or things are creeping up. Absolutely. We can start something. Yeah.
Is Lyme can it be a short-term disease?
It can be. I think, what we've seen is if you catch it in that first 6 months or so and get it treated pretty aggressively, I think it can be pretty well done and dusted. When you get beyond that 6 month, though, I do think it's probably going to stay in your system. And that's not to say that's a bad thing. I mean, we have pounds of viruses and pathogens and bacteria that live in us. We would die without them. So the general idea is like not to squash every microbe that's in your system, because I think there's some damage that can be done with that, but more to get the ones that are causing trouble under control, as well as improving the immune system. So everybody in our age group probably have seen The Lion King, and also kids now love that movie. Yeah. So what I equate that to is there's this immune kind of battle between like Mufasa, Simba situation and Scar, where they're going to exist together. But what you want to make sure is like the Mufasa, Simba situation is on top and the Scar's, hanging out but not causing trouble. So that's what we see often when symptoms develop is there's either an emotional stressor, which is huge for somebody who maybe have been bit years ago. That tipping point changes, and you get that immune dysregulation and the overgrowth of the bad bacteria that can just kind of run wild.
Okay. So for that first 6 month time frame where you say we think it can pretty much be taken out of your system, can it be done without antibiotics? You're saying that there's some integrative options and you can totally extinguish it without doing antibiotics.
I can't know if I can say totally extinguish. I think that gets a little gray. I just don't know if I can answer that specifically. I like to be accurate, and you never know, but I think there's certainly homeopathic options that are super powerful. There's herbal remedies that are just as powerful. You'll see a lot with Lyme that if you read on any message boards or support groups, everybody becomes very obsessed or preachy about the one thing they think fixed them, where they don't see potentially these 6-12 months of other symptoms that might have benefited and set them up to be there. So there's so many different ways to approach the treatment, and I've seen everything work for somebody and everything fail for somebody. So it's really individually based.
It's really interesting when you say like people say it's the one thing that fixed me. I see that all the time, not just with like Lyme, but it's just it's a little frustrating because it's more than just one thing. I mean, you've talked about it too. It's the foundations.
Yes.
We really need to work on those foundations and not just treating Lyme, but everything else.
Yeah. And it sets you up if you do the foundational support, do all the things we all should be doing, which a lot of us don't do. The likelihood of this becoming a problem is much lower, or anything chronically becoming a problem is much lower.
Yeah, so let's dive into that a little bit. Like, what are you're talking about lifestyle habits, essentially. So what are some lifestyle habits that are going to set us up where if we do contract a disease like Lyme or really anything else, our body can fight it off much better? Yeah,
so in that acute sense, we have always focused heavily on nutrition. I do sports nutrition, and it's not really something I do with athletes so much, but it just was a good certification, lays the foundation. You understand all these different biochemical pathways and such. But nutrition is one thing we absolutely focus on, trying to do things that are quote unquote anti-inflammatory, which I hate that word. It's not my favorite, but in that acute sense, like trying to eliminate things that stir up the symptoms. And a lot of that can be highly processed foods, refined sugars, fast food, gluten, dairy, and sugar, the big ones, at least to try to reduce and chill that out. And I know with kids that's challenging, but there are certainly better options now, but trying to do as much as you can from as the food exists in its whole form is huge. Seasonal eating is also really important, and again, from a circadian perspective. But really, the thing that I think, we'll get into this, kind of bleeds into the next episode, but that I've found that I do have patients that come in perfect nutrition. They are doing everything supplementally correct, and they're struggling. And I've been a little curious as to why that is. And I do think it's a little bit of the integration of technology into our world, where we have, unfortunately, we'll get into this more, but there is blue light that dysregulates hormonal balance. And so if we're constantly on devices and such things, mitigating that, using protection, optimizing your sleep cycle, trying to be outside to see the sunrise is huge. That's been one thing also that we're recommending even to non-patients, that if you're struggling, please try to match your life with the outside life. So get bright sun in the morning, and in the evenings, try to keep everything a little bit dim.
Mm-hmm. And that will be our next episode. So if that intrigues you, we're going to have an entire episode dedicated to that topic specifically. How does your treatment differ from if someone just went to a primary care provider? Is it typically just antibiotics? And then do they provide anything past that?
Not as far as I've seen. Most traditional providers, clinicians, that's just what they have. They don't have the access to other herbals, and I don't think it's lack of interest. I think that's just the tools that they have in that system. So yes, typically if you're going to conventional treatment, it is more likely going to be prescriptions, which again, as we talked about, are very appropriate in certain circumstances. I know there's a lot of villainizing of pharmaceuticals. I think that they are useful tools in the right circumstances at the right time. We certainly do have overuse of them, but if you use them strategically in the proper terms, I think that they're very, very helpful. But as far as from a traditional sense, I've really never seen anybody, I mean, they might prescribe a probiotic or recommend it, but beyond that, I haven't seen anything additional for herbal support or anything, even foundational lifestyle stuff.
What are the top herbs or homeopathic remedies that would assist somebody on a Lyme healing journey?
Yeah, so the biggest homeopathic one, and that's a little bit different. I'm sure you've talked to other people. It's more of an energy-based medicine. Lidum would be the first one I would pick for sure. If there's an acute bite, you can just start dosing with that pretty liberally would be my suggestion. And you're asking like what herbals? Mm-hmm. Oh, there's so many. A lot of ours that we utilize are in blends. So to speak to what one specifically, it's really, really difficult. Products that we do use a lot would be from Nutrimedics. Those are some single herbals. You've heard of maybe or maybe not, but like Cryptolepis, there's cat's claw, Japanese knotweed, those types of things. And then there's Biocidin, which is a blend of multiple, and that has actually been studied head-to-head with antibiotics and shown to be actually higher effectiveness in certain circumstances.
Interesting.
And you can combine them together, and that actually helps the antibiotic be more effective. So that's a conversation we have if people want to like just really go after it hard in that acute sense. We may do both.
Is that a Lyme-specific type study, or is that really for anything you would use antibiotics for?
That one was specifically Lyme related, okay. But in theory, that potentially would work for any, because what it's doing, the Biocidin as an herbal, it traps this, it shuts this trap door on the cell wall, so the antibiotic has to stay in and doesn't get to escape out through this little like backup mechanism.
And before we move on to prevention, because I want to spend some time there, is there anything else, any other recommendations, high level, that you would recommend for treatment, or anything else people commonly ask you around treatment?
So just as far as like, I'll run down the list of what we typically incorporate, which we've already talked about: herbs, antibiotics, homeopathics, but also nutrition, the physical exercise. Try to be as active as possible, because when you do feel crummy, you kind of tend to sit inside and watch TV, and that's not always the best thing. Sleep, stress management is huge if you can mitigate those. So just, calming your system, detox support, Epsom salt baths are really helpful. We do lymphatic massage, or my nurses do. And then also skin brushing is a suggestion, feet soaks. We've talked a lot about optimizing the light in your environment and outside. Yeah, so those are the big treatments.
Yeah, and for those of you who did not listen to Uplifted Oncology's episodes, those came right before this, and we talked a lot about lymphatics in that one, which is going to be related to your immune system. So you 100%. Can go back and listen to those as well if you want more information on that. But let's switch gears to prevention. So we want to be outside in nature. We want to go hunting. We want our kids to be barefoot. We want them to go explore the woods, but we also don't want to live in fear of tick bites and other vectors like we talked about in our first episode. What are your top prevention tips?
Around your home, one of the biggest things we do is keep our grass really, really short. So last summer or last May, we took a trip. We were gone for a week and we picked up our dogs from our in-laws. And of course the grass grew a little bit when we were gone. They were outside. I kid you not, a minute, both had ticks attached.
Oh, geez.
So it was like, so that's just something we do. We live in a wooded area. We have deer constantly. I mean, all sorts of animals, turkeys, whatever, running in and out of our yard all the time. So they're going to be there. They've been there before we were. So I'm not, again, going to worry, but keep the area where your kids are playing or where you're playing or spending out, try to keep the grass as short as possible. There are some sprays that are more quote unquote natural. There are like one questionable ingredient, but when you're looking at like, you weigh that out for yourself. Is that okay with you or not? I'm not a big fan of herbicides or pesticides otherwise, just because that could be a whole nother topic.
I mean,
but
it's like chemicals. Yeah.
yeah.
For
So
sure.
that can be disruptive to the GI health as it stands generally. And I just don't like to go there with patient or with what we have in our home.
What is the name of that spray?
Wondercide. So actually on our website, if you go to the blogs, there's a prevention blog with all of this stuff I'll talk about that's linked.
Okay. We'll link to that in the show notes too.
Yes. So that one's, we reference patients there all the time. Like this is a really good strategy. So that's the biggest thing is keeping the lawn short. I don't use herbicides, pesticides. Keep your lawn short and mow your lawn in May. That's like the big thing. No. Like you're not helping the bees by keeping your lawn.
They'll survive.
Long. They'll be okay, but don't spray pesticides and you'll be doing way better. The other aspect, like try not to play where there's a ton of like leaf clutter. They don't particularly care for hot areas. So where there's something that's dark, moist, that's where they're going to chill. So they're going to be hanging around the edge of a property. Maybe if there's a bunch of trees, leaf piles, logs, those would be things. Just don't play in tall, unmowed grass as much as you can. There are things that you can do to treat clothing. There's permethrin. This is something you don't want on your skin. So if you're going to treat your clothes with this, it's usually good for 5 to 7 washes. We carry it. Most supply stores like Fleet Farm or whichever will have this, and you can do it yourself. There's also clothing that you can buy that's impregnated with this, and that lasts the lifetime of that clothing. So if somebody is really hiking a lot, and they just either spray these pants and this is what you use for 5 to 7 times, or buy something that will be guaranteed for the lifetime of the clothing.
Well, and even for kids, it's like, here's your outdoor play clothes. Get home from school, change your clothes into these specific clothes, and then go have fun.
Yep, exactly. Or at minimum shoes, like just spray all I spray my kids' shoes, the whole thing. So all the shoes get sprayed and then they just sit. Once they're dry, safe to put on, but you don't want to be putting these things on until they're completely dry.
And like putting these through the wash with your other clothing, it doesn't like bleed onto that and get on your skin and stuff like that?
Nope.
Okay.
And then there's also a Picardin spray, which is a bug spray. You can use certain essential oils, which I think are on our blog as well, that you can make your own. Those types of interventions are super helpful.
Is this helpful for mosquitoes too?
Yeah.
All of this?
It should be. A lot of, especially the essential oils, the permethrin, I believe it does for most biting insects, but I'd have to double check.
Okay. Yeah.
For certainly for ticks, it's neurotoxic to that creature. So it crawls on the clothing, touches the permethrin and dies. Dr. Green's sent me pictures when he was up in because he has a ton of land in Minnesota where he has a trailer and he loves to just hang out in the woods. Of course, like you would think he would not want to do that.
Run for
but he's
hill.
like, oh, look, the tick died. He just watches them like crawl up his pants and die.
Well, there's a science experiment too for you. It's awesome.
You can make tick tubes, especially if you have, there's mice. And you spray permethrin on these cotton balls. It's kind of a fun thing for, I don't know, maybe older kids. Let them dry and you put them in like a toilet paper roll. You put them along the edge of where like mice would generally run, and they use it to make their nest. It doesn't hurt the mice, but when there's ticks on these animals, it actually kills the ticks. Huh. Yeah. So that's another strategy. Mm-hmm.
Yeah.
Well, I'm thinking about our family cabin right now because where we grew up an hour and a half north of Appleton. I saw wood ticks all the time.
Oh yeah.
Do wood ticks transmit?
They can have other pathogens, but not necessarily Borrelia. They can transmit some parasites, tularemia, Rocky Mountain spotted fever, and ehrlichiosis, certainly with the wood ticks. So,
okay.
Yeah.
Okay. But I don't think I'd ever seen a deer tick until we went to my in-laws' cabin, which is west of Oshkosh. So many deer ticks. but so many mice too. So I'm like, okay, we're going to, this sounds like a great experiment.
Just something to try.
Yeah.
And deer ticks are so tiny.
They are so tiny.
The nymphal ones, which are like the babies, they are the most likely to transmit.
Interesting.
Oh,
And
go
they're
figure.
like the size of a poppy seed. They're so tiny.
Yeah. Size of a freckle.
Yeah.
Really.
Yeah.
Okay. What else do you have for tips on prevention? Anything else that comes to mind?
We treat our dogs with some essential oils. That's linked on our website or on our blog. They wear amber tick collars. The negative ions created by that rubbing on their fur makes it more challenging for the ticks to grab on. And the only time I've seen ticks on my dogs have been on the bridge of their nose with wearing those collars.
I'm definitely looking into this.
Yeah. So those are, I think on Amazon. Then there's those, they also have like shirts you can have them wear like out if you're going to go hiking.
Okay.
And we've been pretty successful with that. And then there's also like a homemade tick spray you can make for dogs on there. Another option, which you can do bentonite clay around your property as well as in the dog beds, and that kills them too. It dehydrates.
I'm going to have to rewind this and listen to it about 10 times because
Well,
there's
you can go
so
to
many
her
good
website,
things.
though, too. Like all this stuff is on your website,
it's all
right?
there for just
Okay.
reference. It was, I think I did it last May. So it's there.
Do you know the essential oils off the top of your head?
Not really.
Okay,
No.
then we'll link to that. But I'm
Yeah.
just thinking about people who use essential oils. They're probably thinking, do I have this in my house?
I'm
Do I
sure they
not?
do. They're
So-
very common.
Okay.
I don't think it's anything like wildly unusual. But I don't want to say exactly, but they're on there. Yeah.
Okay. And then as someone who is very much into gut health and prevention and things like that, what are your thoughts on the typical bug sprays you would buy in the store? Because those do they say ticks on them? Or am I just thinking mosquitoes?
I honestly haven't looked.
Okay.
Yeah.
Do you use those for your family?
I actually use bug spray. There's a couple, I forget, I wish I had the names. One I use is from Primally Pure. So they have an insect spray. I believe Rocasa has a decent one that are, again, more essential oil based. Interestingly enough, though, if you just like slather yourself with plain vanilla, that works well too.
Plain vanilla?
Yep.
Oh.
Like vanilla from your pantry. Yeah.
Interesting.
Oh.
And it smells very nice.
Yeah, it would.
Much better than bug spray.
Yeah.
What about those tick and mosquito stickers that I see all over Instagram now where
Yeah,
it's
yeah.
like stick
Or the
this one
bracelets,
sticker on your
too.
kid's back
Yeah.
and this is going to prevent it. What are your thoughts on that?
I've tried them. I don't know if I remember exactly how they were. I mean, we have terrible mosquitoes, and when we walk around the neighborhood, I'm like, ugh, we just get bit. I get bit all the time. I don't remember last summer if they worked. I don't think they hurt. I don't think they're going to hurt anything at all. It's a safe option for kids, I think. But I think there is some research, I believe, on blood type and which mosquitoes are attracted to which people. So
that's a good point, too.
it just depends, I think, on the person. But I don't think there's any harm in trying them at all.
But
Again,
maybe not as a standalone. Like you would probably still do some of your other
homemade
things.
Yeah, I probably would. Yeah, or at least the permethrin on the shoes for kiddos. But I don't think that's going to hurt a thing. Yeah.
Okay. And then to circle back on the pets piece,
Mm-hmm.
you said that you use a spray
Mm-hmm.
that you make in your house for your dogs. Dogs go in and out a million times a day. How often do you need to spray them?
Oh, honestly, we only do it like in the thick, like coming into like the springtime. That's when ticks become really active. And this is, knock on wood, so far a very light year for ticks, as far as I can tell. Last year we had our first tick bite in February because it was such a mild winter. And caveat being, ticks don't die. They just don't. They're not as fast when it's cold out. Dr. Green had somebody bring in a tick. They put it in a plastic bag and it bred hatched, I don't know how many hundreds of babies. I think he had it in there. I don't know. It was months. It was disgusting.
Instant heebie-jeebies.
Oh my
So
gosh.
gross. So as far as like how often, I probably only do it to my own pets if we're going to be like actually going hiking. I'm pretty good about checking them. I mean, they run in their woods, like their chest area in between like where their arm or their legs insert by their armpits area. The bridge of their nose, sometimes on their head because they're putting their nose down into the grass and such. Yeah.
This was great.
Yeah.
Such a great episode.
I'm feeling really encouraged because, I mean, one thing you said was, within the first 6 months, you have better chance of, taking care of and recovering from that. So that gives me hope. It's not like an instant thing. Obviously, the sooner the better. And then all of these things that you're talking about, they're accessible and natural. Like you can just take care of it and prevent. I love it.
And then
feeling much better.
Going back to our first episode, for those people that have been maybe doctor hopping lately and they're having these symptoms and not getting answers, like that this could be it. And that there's a place so close to us. You're based out of Oshkosh, right?
Yeah.
That can help with this. So that's so great.
Yeah. And if they're curious just even about the symptoms, they can certainly call. We can email them. We have a symptom checklist tracker that we use, which is developed by a physician who is a Lyme specialist. It's validated with positive testing. So it's another tool we utilize for making that court case of this is probably what's going on. So at least it helps you see like the collection of symptoms that you can have, and maybe you don't. Maybe when you look at these, like, oh, this is nothing that I'm dealing with. But yeah.
Awesome.
So they can call and grab that just on their own if they want.
Okay. And if somebody wants to do that, what is your website?
www.gmofwi.com.
Well, we have 2 more bomb episodes coming up. I'm so excited for these as well. So we're going to be talking about circadian rhythm, circadian biology in our next episode, talking about natural light and blue light and a little bit of red light and just how all these things affect us in so many different ways. And then in our 4th episode together, we're going to be diving into homeopathy. And Evey has already alluded to the fact that they are able to use this in Lyme treatment, but you can also use it for first aid. You can use it for short-term injuries. You can use it for long-term chronic disease, all these different things. So we're going to dive more into that in episode number 4. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.